Updates on drug diversion issues. The objectives of this presentation are to define what drug diversion means, describe the extent of the current problem of diversion and the illicit use of opioids in the United States, and to identify what is being done to combat drug diversion. Drug diversion can be defined in many different ways. The use of legal drugs for illegal purposes, or the use of prescription drugs for illegal purposes. According to the Department of Health and Human Services, drug diversion is the illegal distribution or abuse of prescription drugs or their use for unintended purposes. Drug diversion can result in drug addiction, overdose, drug-related emergency room visits, and death. It has also contributed to an increase in substance abuse treatment admissions. Drug diversion may occur at any point during the distribution process. This includes the manufacturers, the distribution centers, physicians, pharmacists, patients, and other healthcare personnel. There are many methods to how the drugs are diverted. There are doctor shoppers. Doctor shoppers are people who obtain multiple controlled substance prescriptions from multiple providers. Drugs may also be obtained by theft. This could be done through committing robbery or stealing medications from friends, relatives, or the workplace. Drugs are also diverted through forgery. This can be done by writing a new prescription, changing the writing on a prescription, or posing as a provider and calling in a prescription. Diversion is also done through illicit prescribing and illegal sales. The drugs can be purchased from dealers, from friends or relatives, and through illegal internet pharmacies. Prescription drugs are diverted or abused due to dependence and addiction. They are diverted to self-medicate. They are diverted to alleviate withdrawal symptoms, and they are also diverted for monetary gain. The chart on this slide shows where prescription drugs are being obtained. 80.7% of prescriptions are coming from one doctor, but 55.7% of those prescriptions are being diverted to a friend or relative for free, and another 14.8% bought or took them from a friend or relative. In 2015, a study was done by the National Survey on Drug Use and Health on Americans 12 years of age and older regarding their use of prescription drugs. The prescription drugs included pain relievers, tranquilizers, stimulants, and sedatives. In the study, they referred to this group of medications as psychotherapeutics. In 2015, 119 million people used psychotherapeutics. That is 44.5% of the population aged 12 and older. 82% of the 119 million prescriptions were for pain relievers such as hydrocodone, oxycodone, and morphine. 18.9 million of the people using psychotherapeutic medications admitted to misuse. In the study, misuse was defined as any way not directed by a doctor, including use without a prescription. The psychotherapeutic medications most commonly misused were prescription pain relievers. It was previously noted that the most commonly misused medications were prescription pain relievers such as hydrocodone, oxycodone, and morphine. These medications are all opioids. Heroin is also classified as an opioid. Some facts regarding the United States. Even though the United States makes up less than 5% of the world's population, it consumes 80% of the world's opioid supply and 95% of the world's hydrocodone. On an average day in the United States, more than 650,000 opioid prescriptions are dispensed, and 3,900 people initiate non-medical use of prescription opioids. The United States spends more than $55 billion in health and social costs each year related to prescription opioid abuse. In 2014, healthcare providers wrote 240 million prescriptions for opioid pain relievers. This was enough for every American adult to have a bottle. There are twice as many painkiller prescriptions per person in the United States than in Canada. Prescription opioids are the most commonly diverted controlled prescription drugs, and due to this, opioid-related deaths are dramatically increasing. 78 Americans die every day from an opioid overdose, and 46 of these deaths involve a prescription opioid. The most commonly overdosed opioids are methadone, oxycodone, and hydrocodone. According to the Centers for Disease Control, more people died from drug overdoses in 2014 than in any other year on record. 6 out of 10 of these deaths involved an opioid. Since 1999, the number of overdose deaths involving opioids has nearly quadrupled. The amount of prescription opioids sold has also nearly quadrupled, even though there has not been a significant amount of change in the pain that's being reported by patients. Prescription drug abuse has been labeled as an epidemic by the Centers for Disease Control and Prevention. What's causing this amplified epidemic? In the 1990s, pain as the fifth vital sign was adopted. This concept originated because pain was allegedly being undertreated and led to increased opioid pain reliever prescribing. This led to unrealistic expectations of patients that pain medication is capable of the complete elimination of pain. There was also a lack of knowledge among providers regarding current pain management guidelines, risk management practices, and research in pain medication. There was also a lack of knowledge about addiction, dependence, and misuse that has contributed to the epidemic. Patients were part of this problem. They lacked the knowledge about the risks associated with opioids and had the assumption that because it was prescribed to them, it was safe. They also lacked the knowledge of how to safely store the prescriptions and how to properly dispose of them. This has led to diversion of medication by family members and friends. What is being done to combat the epidemic? Nationally, the federal government is working to promote prevention of prescription drug misuse. They want to strengthen the state-run prescription drug monitoring programs. Prescription drug monitoring programs have been named one of the most promising tools to curb prescription opioid abuse. These programs gather electronic data to track controlled substances. The information gathered can then be used by prescribers and pharmacists to look for suspected abuse or diversion. The Centers for Disease Control is helping some states with funding for their prescription drug monitoring programs through the Prevention for States program. The money is used by the states to enhance their prescription drug monitoring programs. This includes making the programs easier to use and easier to access, and getting more providers to use the database. The money is also used to evaluate policies and to come up with ways to prevent prescription drug overdoses. Many states have already begun to pass laws to mandate the use of prescription drug monitoring programs and have passed laws regarding pain clinics. Florida established their prescription drug monitoring program in 2010 and also passed laws to regulate pain clinics. By 2012, they saw a 50% decrease in the number of deaths due to an oxycodone overdose. In 2012, Tennessee started requiring prescribers to check the PDMP before writing a prescription for pain medication. In 2013, they saw a 36% decline in doctor shopping. This goes to show how valuable of a tool the PDMP is. The Bureau of Justice Assistance is also working at prioritizing requests for Prescription Drug Monitoring Program grant funding that involves the sharing of information between state prescription drug monitoring programs. The DEA is working on prevention of prescription drug misuse by ensuring safe disposal. The DEA holds National Drug Take-Back Days to encourage the proper disposal of prescription medications, and they are looking to expand the number of disposal bins in pharmacies. Another item that is being worked on at the national level is the prevention of overdose deaths with naloxone. The Bureau of Justice Assistance has released an online toolkit for law enforcement agencies looking to establish their own programs. The Substance Abuse and Mental Health Services Administration has also released an opioid overdose prevention toolkit to help communities and local governments develop policies and practices to prevent opioid-related overdose deaths. The Centers for Disease Control also adopted the guideline for prescribing opioids for chronic pain in 2016. The Centers for Disease Control developed this to provide recommendations for the prescribing of opioids in primary care settings, and it focuses on treating chronic pain. Nationally, they are also working to investigate and prosecute high-impact cases, enhance regulatory enforcement, and encourage information sharing. They are also looking into additional treatment options to help with those suffering from addiction, such as early intervention, medication-assisted treatment, and treatment options through the criminal justice system, such as drug court. Prescription drug misuse is one of our nation's fastest-growing public health problems, and investigation of drug diversion are on the rise. The problem of drug diversion is complex and often involves multiple parties. To combat the epidemic, federal, state, and local agencies, as well as health systems and providers, need to work together to develop solutions to this complex problem.